you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about an odontogenic cutaneous sinus tract. By definition, an odontogenic cutaneous sinus tract is a chronic condition that is characterized by a small opening common on the face or the neck, and it is as a result of infection of the teeth. And this small opening usually drains pus. Connected beneath this small opening is a tunnel that leads to the roots of the teeth. And just on the roots of the teeth is an abscess, that is collection of pus as a result of infection of the teeth. The commonest locations for the odontogenic cutaneous sinus tract is the face and the neck. For the face, we usually find it below the chin and along the jaw, and sometimes below the jaw. The clinical presentations of the odontogenic cutaneous sinus tract is that it usually presents as a painless opening, usually on the face and the neck, along the areas of the face that I've just detailed. Sometimes there is evidence of infection of the teeth, but sometimes the affected individuals don't have any evidence of a tooth infection, but the roots of the teeth can actually be infected. So that means that the patients will have infection of the roots of the teeth without apparent evidence of infection on the teeth, because remember that the roots of the teeth are embedded deep into the gums, so the patients will not even be aware that they have a tooth infection. So this can easily lead to a misdiagnosis in majority of the patients, and these patients will visit several specialists. For example, they will visit physicians, they will visit general surgeons, and the diagnosis can easily be missed out until they visit a dentist. Interventions will be initiated by the different specialists, but the patient's condition will not get better. In fact, it will recur until the patient goes to the dentist for proper management of this condition. So if you see a small opening on your face or on your neck that is discharging pus, it is very, very important that you at least visit a dentist, because it can be a possibility of an odontogenic cutaneous sinus tract, which will not get better until it is managed by the appropriate specialist. The dentist will carry out a thorough dental exam, and he will easily pick up a possibility of pus collection in the roots of the teeth, even though the teeth will not have evidence of apparent infection, because the dentists are more experienced in carrying out the dental examinations, including the roots of the teeth. So it is very, very important that the affected individuals visit a dentist on addition to other specialists, such that we can rule out a possibility of an odontogenic cutaneous sinus tract, because the patients suffer a lot if the condition is missed out. In fact, the condition will recur even after other treatments have been initiated, until proper treatment has been done. The investigations that we carry out in odontogenic cutaneous sinus tracts include a discharge study, where we take off a sample of the pus from the opening, and we can carry out some tests. For example, we can do a culture sensitivity, where we find out the bacteria that is in the pus, and then we can also do a dental x-ray, and this is usually diagnostic of the abscess, especially on the roots of the teeth. We can also do CT scan, that is a dental CT scan. When it comes to the treatment of the odontogenic cutaneous sinus tracts, the following treatment modalities have shown to work. Antibiotic therapy, and this is usually tailored by the culture and sensitivity results. We can also do a combination of excision of the sinus tract together with extraction of the affected teeth. We can also employ root canal therapy or a combination of the root canal therapy and tooth extraction, that is, extraction of the affected tooth. When it comes to the prevention of the odontogenic cutaneous sinus tracts, the following can help. Please exercise proper oral hygiene, and this entails brushing every after a meal. For example, if your meal plan is that you have 3 meals a day, for example, breakfast, lunch, and supper, please brush after breakfast, then brush after lunch, and then brush after supper. And make sure that you don't snack in between meals, because that means that you're going to re-expose your teeth to food. And just in case you snack, please brush your teeth, but I highly recommend that you don't snack in between meals. Please also clean in between your teeth. You can use interdental brushes, or you can use floss. You can use floss wires or floss picks. Please also change your toothbrush every after a month, and please have regular dental checkups with your dentist, such that if there is any tooth infection, it can be arrested on time. Please avoid smoking, and please avoid trauma to your teeth, because sometimes you might not have had infection of the teeth, but you could have had trauma, and then this could have led to death of the teeth with subsequent formation of an abscess, that is pus collection in the roots of the affected teeth. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.